To get ready to celebrate International Women's Day this coming Wednesday, the Ministry of Health is taking a bold step, and this morning we're going to feature it inside the Spotlight on Now.
Now, on March 8th, which is this Wednesday, the countries around the world will unite to eradicate the inequities that women face. Although this year's international theme is digital, innovation and technology for gender equality, the Ministry of Health, in promotion of this specific need, has selected a theme, I Choose Me, Greater Access, Better Health for Women. In observance of International Women's Day, the Ministry of Health will be executing a national screening and women's health education drive commencing on March 6th. And joining us this morning to talk more about it is the Minister of Health, Mr. Terrence Deyalsingh, and General Manager Nursing at the North Central Regional Health Authority, Ms. Dianne Hinneh. Good morning, Minister. Good morning, Ms. Hinneh. How are you this morning?
Thanks.
Good morning. Good morning to all of you and all your wonderful viewers and listeners.
Now, Minister, a very interesting theme, I Choose Me, Greater Access. Tell us about the theme, tell us the purpose of it, and what is the outcomes? What sort of outcomes are you expecting following the execution of this program?
Yeah, so the reason why we chose that theme, I Choose Me, we want women to put themselves first for once. You know, women generally put themselves last. They put their husbands, boyfriends, partners first, they put their children first. They put their careers first, and they see about themselves last. For this week, we wanted to put themselves first, and hopefully this will be a lifetime change. Because women carry an unequitable burden when it comes to society. They are the principal caregiver in homes, they are single mothers, and so on. And in the theme, Better Health for All Women and Greater Access, we start today, it's a week of activities. Each of the 5 RHAs, the 4 in Trinidad and 1 in Tobago, will be having a week of activities, and we culminate on Saturday and Sunday with centralized screening for pap smears and referrals for mammograms, teaching women how to take care of themselves as it regards these 2 major cancers, which are the 2 major causes of death of women due to cancers.
Right. And I'm going to go to Nurse Hinneh for this one because I just wanted to know what was the purpose of focusing, of course, on breast cancer and cervical cancer.
So thank you this morning for having me. Breast cancer is the leading cause of death for women in Trinidad and Tobago. And so the minister, in his wisdom, would have launched this robust campaign to ensure that we capture as much women with regards to their status, where breast cancer is concerned, or even cervical cancer. The aim of this is early detection and prevention. And that is the reason why we having such robust screening, so that once it is detected early, something can be done about it. Of course, the screening is different for breast cancer as compared for cervical cancer, where you have pap smears for the cervical cancer to determine a diagnosis, but for the breast cancer, there's examination, breast examination, and also mammograms that will determine if a woman is diagnosed with breast cancer or cervical cancer. So it's imperative that we understand how important it is for women to screen. I choose me. I choose to take better care of myself as a woman. It's about empowering women to take responsibility for their health. And of course, a healthy woman is a healthy nation.
Now, the breast cancer and cervical cancer screening, that's happening on this Saturday, yes?
Yes, it is.
Right.
But not only in one region. We are having it in all the regions. Throughout Trinidad and Tobago, or 5 regions, we are doing screening, inclusive of Tobago. And they have different activities, to the point where Tobago is saying, okay, we're going for a further month of screening post International Women's Day or week. Right. And so therefore, we are having this drive. We have routine pap smear initiatives throughout the year, at different regions. So it's nothing that is only going to take place during this week. It's a continuation of efforts by the Ministry of Health to ensure that we have a healthy population, women's population in Trinidad and Tobago.
Now, Nurse, you mentioned it's happening at the 5 RHAs.
Yes.
So, for example, could somebody go to Mount Hope? Is it an open day thing? How exactly is it going to be rolled out this weekend?
Definitely. So every region, we buzzing with excitement because we are about caring for people, we are about saving lives, and each region have different activities carded for the week. And so we, for example, the NCRHA, we had the Copy Center where they're starting from today actually,
right.
And they're rolling out booth displays. We are having screening, but not only for cancer. We are having diabetic screening, hypertensive screening, HIV, and mental health.
Right.
Extremely important. Right. And this is to take place from today throughout until Sunday, where we will culminate with the initiatives, the Pap smear initiatives, where staff, anybody, bring your friend. A friend, bring a friend. Even the husbands you're asking, bring your wives.
Yes.
Children, bring your mother, bring your sister once they fit the criteria to get the screening process.
Right.
In NWRHA, we have webinars, we have women talks where we're going to bring in people to talk on issues such as gender-based violence, cyberbullying. They are going to also partner with the NGOs. They're going to have a big march around the savannah and culminate Saturday in the grandstand. That is Northwest. So even for mental health, they're having sip and paint, where they're going to discuss mental health among the staff with regards to women. And so they are going to have this sipping and painting competition.
So from today until Sunday, there's going to be various activities at the different regional health authorities.
Sure.
So I know you may not be able to mark all now, but
yes.
if we need to get more info, is there going to be a public education? Is there going to be advertisements or everything posted to the ministry's page?
It's already being advertised on the individuals regions page. So you could go up on NCRHA page and you will see our schedule, NWRHA, Eastern. Everyone has a website, and therefore the information is posted there.
Nice. Now, Minister, I'm coming back to you because I know that, so we have this drive that's happening in terms of screening for breast and cervical cancer. But what is the follow-up? Does the Ministry of Health have services for women, for example, who have been detected or who have been identified as having, either breast or cervical cancer?
Yeah, so Nurse Hinneh's enthusiasm is contagious this morning. Yeah, she's excited and I'm excited.
Yes.
And the answer is yes. We just don't screen people, tell them their status. Of course, once we know that they are precancerous or stage 1, stage 2, stage 3, we refer them for treatment. We just don't leave them alone. And that's important. And as Nurse said, whilst we are highlighting this for this week, we do this type of thing throughout the year. So it's a continuous program of activities. And to show you how serious we are about the theme, better health, greater access, I have in front of me the flyer for the Sans Souci Health Center. Now, I paid a visit up to Sans Souci, Matlot, and Grand River on Friday, because this is throughout the country, rural areas everywhere. And in Sans Souci, they have your know your numbers, blood pressure testing, glucose testing, body mass index, vision screening, HIV testing and counseling, food and nutrition, blood investigation, medical social work counseling. So it's all. It's from Toco, Sans Souci, right up to Charlottesville. To every single health center this morning has a program of activities. And what we hope to come out of this is to embed in women that they need to be more proactive and put themselves first when it comes to their health, and not put it after their husband's health or their partner's health, their children's health. Put yourselves first, because as Nurse Hinneh said, a healthy woman is a healthy Trinidad and Tobago.
Yeah, and of course, Minister, the services that are available to women, is that it's available in every region? Because I know sometimes, breast cancer to treat or cervical cancer is very expensive. And so can we have the guarantee that if somebody has been identified as you mentioned, precancerous, there are services available in the public health system that can help them with this?
Yeah. So treatment is available at centralized locations because when they come to these tertiary services, so Sangre Grande will have their oncology center, North Central, St. James, San Fernando, Tobago. So the treatment is there, but we need to get them screened to put them on that treatment pathway
Right.
so that we can catch them as early as possible so that they can have a better outcome and a better quality of life.
Nice. Thanks, Minister. Nurse Hinneh, I'm coming back to you because I know that, well, recently, and I'll say maybe the past 10 years or so, the ministry has been trying to get people to buy into the HPV vaccine
Yes.
as a way to prevent cervical cancer.
Yes.
Has the ministry still been doing this? And are you seeing more parents bringing their children to get the HPV vaccine? Do you think more awareness needs to take place? I mean, what's the importance of the vaccine?
Okay, so the HPV vaccine is extremely important because it is the preventative care for cancer, as well as it is prophylaxis going forward for the age group of, according to WHO, 9 years and above for boys and girls up to 26 years old. It is a preventative measure for cervical cancer or cancer of the throat or cancer of the mouth, because it is formed from a collation of viruses that affects the skin as well as the moist membranes. So once these viruses goes into the skin or to the membranes, they can cause genital warts, they can cause cervical cancer, and so therefore it's a preventative measure so that the person wouldn't contract these cancers. So what we're encouraging parents to do is to get your children vaccinated over the age of 9 according to WHO. Now we are targeting the standard 4 and 5 and above, and they have been parents that have been consenting for their children to be vaccinated, which is good. We have been having uptick. Right. But we have seen evidence in countries where it is overwhelming, where people would have taken the vaccine, and therefore the degree of cancer, this cancer, is extremely lower as compared to those countries that were not taking the vaccines.
Now, nurse, should you take the vaccine in addition to getting pap smears? I mean, how often should women get pap smears? Is there a certain age at which you should start getting pap smears as well?
So pap smear should be ideally from 21 and above, and once you're sexually active, right? And once you're taking a pap smear, you do it routinely each year. And once you have a negative results, the clinician will determine how often that you should take it.
And in terms of the screening for breast cancer, apart from the campaign that's currently running, can any woman just basically go into, let's say, a health center or even a hospital and say, listen, I want a pap smear or I want a mammogram? Is it as simple as that?
Well, the health centers, there are days that are designated to do the pap smear, and therefore you go and make an appointment. But there are times when you have walk-in and you're accepted because of whatever is presenting with you. And so therefore you can walk into health centers, make an appointment, because there are specific days in the health centers, and of course, based on the findings, you will be referred to other areas of care.
Minister, I'm coming back to you. Any sort of advice for the public as we have this national drive that's going on? Any sort of motivation you want to give them to come out this week until Sunday?
Yeah. So the motivation is, look, data doesn't lie. And when we educate people, especially women, the health outcomes are better. I'll give you an example. On becoming Minister of Health back in 2015, the major issue facing this country was maternal mortality, correct? Too many women were dying in childbirth. One of the things we found out was at that time, 40% of women waited until week 20 in the public sector to seek antenatal care. Think about that. 40% waited until week 20, that is the half point of your pregnancy, to seek antenatal care. That is bad. Because of education, because of talking to people, we have now dropped that to 20%, waiting until week 20. So we have halved it. And because we have done that, the rates of maternal mortality has dropped. Data tells us that when we engage in health-seeking behavior earlier rather than later, the outcomes are better. We are having similar success stories with our NCD program. We don't have enough time here now on hypertension and diabetes, but at another time I could share the data. The point is, when we educate people, give them the information, engage them, encourage them, the health outcome is better. And we are hoping with this heightened week of activity, if we could target as many women as possible to be more proactive, be more aware of your health status, your outcome and your family's outcome and the country's outcome is going to be significantly better.
And we're going to put a pin in that, Minister, and definitely have you again next time for the NCDs. And I wanted to pick your brain about COVID-19, but I'll let you off the hook this time. So thank you so much for joining us. Thank you so much for joining us on the Now Morning Show. All the best with the program, and I hope that the women do in fact come out and get tested. So thank you so much.
Thank you very much. Bye-bye.
And that was the Minister of Health, Terrence Deyalsingh, and of course, General Manager Nursing at the NCWRHA, Ms. Dianne Hinneh, just talking about a campaign that's happening this week that's going to be helping you with screening for not just breast cancer, but also cervical cancer as well. You're on the Now Morning Show. We're going to take a break and be right back, but stay with us because up next, we take your phone calls. Remember, our number is 622-4010. Stay with us.
They will pretend to build you up. That's right. Just to pull you down.